Hello everybody, my name is Serge Dumont. I am the chairman of Asia Society France, the first Asia Society center in the European Union. Our mission is to create a better understanding of Asia in Europe and help build trust and deeper links between the two continents. It is fitting that we are meeting today in Brussels for a very topical discussion on public health with two of the world's leading experts. The remarkable results achieved thanks to the international mobilization in the fight against AIDS, TB and malaria, in which France has been a pioneer since the mid-90s, made us lose sight of the fact that these and other major epidemics are not a thing of the past, but remain a constant threat to humanity. Everyone can measure today with COVID the huge impact and cost public health crisis can have on our societies and our democracies. Only a coordinated and supportive approach aiming at accelerating scientific progress and disseminating its benefits in the broadest and most equitable way possible can make it possible to deal effectively with the new health and social challenges. For AIDS, TB and malaria, the key challenge was and remains the widest possible access to treatment and diagnostic tools. For COVID and the diseases of tomorrow, the biggest challenge is to accelerate and scale up public preparedness and prevention strategies while anticipating new diagnostic and treatment tools. It is our privilege to welcome today two eminent experts and leading players in the field of global health, Dr. Piot and Dr. Heidi Larson. We share a very long history and have been friends for over 20 years. Dr. Piot is the special advisor on COVID-19 to European Commission President Ursula von der Leyen, the former founding executive director of UNAIDS, and a renowned microbiologist known for his research into Ebola and AIDS. He is also the former director of the London School of Hygiene and Tropical Medicine, a 2014 Time Person of the Year, and the laureate of the Hideo Noguchi Africa Prize and the Prince Mahidol Award. In 1976, he co-discovered the Ebola virus in Zaire while working at the Institute of Tropical Medicine in Antwerp, Belgium, and led research on HIV/AIDS, STD, and women's health, mostly in Sub-Saharan African. And last but not least, he is a distinguished professor at the National University of Singapore. Dr. Heidi Larson is a professor of anthropology, risk and decision science, and the founding director of the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine and at the University of Washington, Seattle. She is also the former head of global immunization communication at UNICEF and has had various roles in South Asia and in the South Pacific region. She has a PhD from the University of California, Berkeley, where she was a foreign language and area studies fellow, Hindi and Urdu, and she has a BA from Harvard University. Professor Larson research focuses on the analysis of social and political factors that can affect uptake of health interventions and influence policies. Her particular interest is on risk and rumor management and building public trust. She was named by BBC as one of the 100 most influential women in the world in 2021. Peter, first of all, let me thank you for welcoming us to your beautiful home in Brussels. You've been at the forefront in the fight against infectious diseases for a lifetime, basically, as a doctor, a physician, but also as the head of UNAIDS and the founder, actually, of UNAIDS. And although spectacular results have been achieved over the last 10 years, what we have seen is that COVID has had a terrible consequence on the care of AIDS patients, but also on the fight against malaria and especially TB. So after 2 decades of progress, suddenly we are seeing all the indicators going in the wrong direction. So can you tell me, what are we getting wrong? What happened? Why are we facing this situation?
Well, hello, Serge, and it's really a privilege to, to be with you and to also support the Asia Society. I think it's really essential for the future of both Europe and Asia that we're getting closer together and understand each other. Mm-hmm. The direct impact of epidemics and of a pandemic like COVID-19 is fairly well documented, with millions of people dying in the hospital, long COVID, and just name it. What's less well appreciated, but is at least as real, is the indirect impact. Impact, of course, on people's mental health as a result of, not only the stress of being infected, but also of lockdowns and so on. It has also drained a lot of resources that were necessary to stop this pandemic. Because the reality is that when you have an epidemic and a pandemic, it really is not only affecting those who have it and who die, but society as a whole. And if we can't control the epidemic, we can't do everything else we have to do. And that is one of the reasons, and the main reasons, that care for people with HIV, that prevention programs, that even childhood immunization, vaccination against, let's say, measles, which is life-saving also, have really suffered enormously because of the inability to organize campaigns, because of all the health resources went to controlling the pandemic. And of course, the poorer a country is, or the least well-organized health system is, the more the local population will suffer. And that has also been the case for people with HIV. So we're not out of this epidemic yet, I can tell you that.
When do you expect that we'll be out of it?
I don't have my crystal ball here. I left it in my office. But no, I think that we are entering definitely a new phase. And that is thanks to, on the one hand, vaccination. Certainly in countries that have been benefiting from that. The virus is still mutating. A lot will depend on what the virus will come up with. We don't know. We've had plenty of surprises. If the next mutation, the next variant, is one that escapes completely our immune system and our protection, then we're in trouble. But I think the most likely scenario is that we will go to a situation where the virus will circulate, and then now and then we'll see an outbreak, an epidemic, a bit like with flu, with influenza, in the northern hemisphere, probably every winter for a long time. But thanks to vaccination and also natural immunity, we die far less often, and from COVID end up far less often in the hospital in intensive care. And we see that indirectly in those countries, those populations where vaccination is low, you still see a huge mortality. So we are in a better place, but it's not over yet. And what I'm concerned about is that today in many countries it's going down in a big way, and that we are becoming complacent and dismantling all the vaccination campaigns, wearing of masks, diagnostic services, and we'll have, in a few months' time, we'll have to rebuild all that again, which would be completely not only stupid, but a major waste of resources and a waste of time, which will cost lives.
Mm. You just returned from India and Singapore, and you've been following the developments. You're advising the president of the EU on COVID-19. So when you look at all the strategies that have been employed by the various governments, what do you think has been successful and what hasn't worked?
Well, I think that the jury is still out what really has been the most successful strategy. In the beginning of the epidemic, 2 years ago, or more than 2 years ago, and before there was any vaccine, I think most Asian countries, particularly East Asia, China, this is Hong Kong, we have Singapore, Japan, have done much better than the West, than Europe and North America, and you can see that by the death rates by population. The initial strategy of what we call zero COVID, kind of controlling it, completely eliminating, I never thought that was feasible because only one virus has been eliminated, and that is smallpox. And getting rid of a virus that's so contagious as this coronavirus, SARS-CoV-2, be very difficult. And so what we're seeing now is that we are seeing countries that are initially did very well, but now are in trouble. When you look what's going on in Hong Kong, for example, okay, it's getting better. Singapore, on the other hand, has had quite a flexible approach in the sense that very effective lockdown, or not a complete lockdown, that never happened there, but measures, and with a population that is quite disciplined, and that worked very well, but has opened and is gradually opened because we can't continue to be completely isolated and prevent the economy and society from working. It's not only an economic issue, but also mental health and so on. In Europe, we are now in a new phase with, thanks to vaccination. And there, for me, the question is, will we maintain a basic level of precaution, and will we be ready for the next wave and even for the next epidemic? Because I'm sorry to say so, but there will be other epidemics. That's been part of the human condition since we became sedentary people.
Exactly. Well, you were the co-discoverer of the Ebola virus. So do you think that the next epidemic will be coming from Africa or from Asia, or could it come from anywhere?
Well, it can come from anywhere, that's for sure. Look at the variants in the beginning of SARS-CoV-2. In the beginning, we gave it a name, the English one or the South African one. I think that is, or some called it the China virus. One, it doesn't help, but often it's also not totally correct because we don't know. Look at the Spanish flu 100 years ago. Had nothing to do with Spain. In epidemics, you blame it also always on someone else. So it can come anywhere. And certainly with this virus, this coronavirus is all over the world, and it's mutating, and that can happen here in Brussels tomorrow. It can happen in Buenos Aires, it can happen in Hanoi, anywhere, or in Africa. But there are viruses that are more specific to certain continents, like Ebola, because it's carried by bats that are circulating in Africa. We have like Nipah virus, which you find in, more in the South Asia and in Southeast Asia. So these are specific ecological niches. But the concern that I have is for the next pandemic is a respiratory virus like influenza, like coronaviruses, and that can spread in no time all over the world. We've seen that can happen. So it can come from anywhere. That's also why international collaboration is so vital. No country will control this without every country having controlled it. There's no way that you can fix this alone. And also, we need early warning systems. In other words, we need to know when the next virus comes up or the new variant. That means free exchange of information. Keeping that for yourself may be interesting for a while, but it's going to hurt everybody. So we need this strong cooperation, and that's why also, for example, it's in the interest of Europe to have very close contact with what's going on in East Asia, Southeast Asia, South Asia, because what happens there can be a problem tomorrow, and the other way around. Something that can come from Europe and could become a problem in Asia. So that's one of the big lessons of this epidemic. We need this global cooperation, and also at the regional level. you know.
Have we had this cooperation? I mean, you see that, for instance, there has been a lot of inequality in the distribution of vaccines. So are we better prepared for the next pandemic? Have we learned our lesson?
I think on the positive side, there's been a lot of collaboration and sharing of information when you consider how fast the genetic sequence of the first virus coming out of Wuhan was shared immediately with the rest of the world, and that allowed the development of vaccines. We don't have yet enough like a systematic type of approach. For example, take Asia. ASEAN exists. I think it's time for ASEAN to create an ASEAN Centers for Disease Control, just as we have one in Europe, and there's the Africa Center for Disease Control. So that's on the positive side.
China.
Yeah, and China did that after SARS, you know, and really, you see that's a great investment when the next epidemic comes. Where we have failed is the, you know, equity in access to vaccines for COVID. And that was grounded in scarcity. So spectacular achievement of science, because in 10 months we had a vaccine. I never thought that would be possible. It was really so ununique, never done before. And that was great. But then the manufacturing, that took much, much longer. And that's normal. You have to set up a whole supply chain and manufacturing chain and even construct new buildings and so on. And there, scarcity is a big enemy of equity. And so that's where those with, you know, the wealthiest and most powerful countries have had first access to vaccines, or whether they were produced locally, be it that in China, be it in India, the pharmacy of the world, Europe, North America. And this is something where we need to prepare for the future, that hoping that the science can be as fast as it has been now, but that also we keep like what we call a warm manufacturing facilities in so-called peacetime, in between epidemics. And once we have a new epidemic, a new vaccine, we can immediately trigger that. And that's why, for example, in Europe, we're setting up HERA, it's the Health Emergency Response Agency, the European Commission and the European Union have set up, that will indeed invest in this kind of facilities, support the research, the procurement, and that's what Singapore is doing in the mosaic, Japan, China, several countries. But I think here again, some international collaboration would be beneficial to everybody. And then we always have the politics, because one of the reactions to an epidemic is often closing the borders, banning exports. We had it in Europe also, but that was solved quite rapidly, thanks to the leadership of Ursula von der Leyen, you know, as the European Union, and in other countries has taken longer. But again, no country is safe until we all are safe.
This leads to a question that I really want to ask you. Heidi, you wrote a great book, Stuck, about, actually the title is Stuck, How Vaccine Rumors Start and Why They Don't Go Away. Can you tell us, because this played a critical role in this epidemic, the role of rumors, and how can we counter these rumors, how can we deal with the rumors? Can you tell us really what's in your book?
Yes. Well, I mean, one of the points in the book is that you can't just clip the heads off of misinformation and rumors and expect them to go away, because they're driven by deeper anxieties and other issues, and they're kind of sleeping giants that when an opportunity for them to come up, when you have this underlying anxiety and then you see an event that's not explainable, all those things come up. So I talk in the book about we should be gardening rumors rather than trying to delete them, because we're not really deleting them. And what's happened in COVID is we had already an environment with all the reports on trust in the world showed that we were on a 10-year decline before COVID. So when you think about the environment that COVID landed in, low trust, already a growing amount of vaccine hesitancy and skepticism in society globally, better in some places than others. We had a 10-year plateauing of childhood vaccination, in some countries dropping. So I think things that you want to blame on COVID, or one would like to blame on COVID just exacerbated all these weak spots. And as Peter said, if you had a weak health system to begin with, this took it to another low. If you had a stronger one, you probably did a bit better. And it's not just about health systems, because we had to go out of the health systems. So I think, and the message in the book is that we really need to listen to what's really going on with people's concerns, because we can't take rumors at face value. You can have 5 different countries, the same rumor, but the reasons for that rumor is quite different. Rumors that vaccines will sterilize you. Well, in some cases, it's in communities that either have a history of forced sterilization, so they have a historic memory. In other cases, it's, a marginalized group that has some pretty existential concerns about a dominant government. There's a lot of different reasons, but unless we understand what the reasons is, and sometimes it's very practical. That's the other thing. We think that, this is some big conspiracy, but sometimes when you talk to people, actually, they're frustrated about not being able to get a vaccine, or it's too confusing, or they don't know how to use this new technology, but they don't really want to say that. They'll blame it on a rumor. So the biggest point is to say we need to listen, we need to understand what's really behind the rumor, rather than just trying to hit it on the head and debunk it, because if you don't deal with the roots, and that we should really pay attention to this moving forward. There's a lot of cues in these rumors for what we need for what I would call societal preparedness moving forward. There's a lot of infrastructure issues, a lot of supply issues. There's a lot of other things that are going to need some serious looking at and rebuilding for the next shock to the system. But I think one thing we really haven't paid enough attention to is how do we prepare societies for these things. The U.S. is not an issue of they didn't have any money. People died for political reasons, for belief reasons, for lack of trust, and not only there. So I think we need to. When people ask me where the success stories were, I look at these local groups, these trusted networks. I mean, Peter and I heard a heartening story of a network in India that kind of became a network to support people with HIV. But in the context of COVID, they repurposed, they came together. So they were an existing trust network. And what we really needed in COVID was to leverage where there is trust. The problem is we don't have a lot of trust going around. So I think that's an area we really need to invest on building. And I promise you the rumors will go down where the trust is higher, because you're willing to take a bit of a risk if you trust somebody. If you don't, you're going to be looking for a reason, not...
And to ask the same question that I asked Peter, if you look at the way the pandemic has been handled, did you feel that some governments have done better than others from a rumors management perspective and trust building perspective?
Yes, absolutely. I mean, and I think it's... again, some of them that already had a good trust relationship with their public, Portugal, for instance, they did better just because that trust fabric existed. There were new things that came up that weren't there before. Some handled it better than others. I think we really need to have a hard look at the relationship with technology and how dependent the response became on technology. And that was fine if you happened to be walking around with a smartphone and had a fluency in it. But there were a lot of, it really exacerbated the haves and the have-nots. You had families, even in poorer countries, communities in the U.S., where there might have been one device or laptop in a household and 3 kids homeschooling and 2 parents, and maybe one of them needed. What do you do in situation? How can we, have alternatives? Because in a lot of cases, there wasn't really an alternative. If you didn't know how to navigate the system, there were some success stories where I saw people buddying, and they would go to neighbors and say, do you need help to understand? How do you make your appointment? How do you do this? Because we took a lot for granted that I think we need to have a good look at how we can make some of these, make people build that capacity, and we need to start in schools with kids.
At this point, I'd like to turn to the audience. I'm receiving a lot of questions. I didn't have time to read them, so I'll take the last one. I have one from Valérie. From Valérie Terranova. Beyond vaccine, the pandemics have shed light on huge discrepancies in other vital areas, such as access to oxygen, as seen in India. What can be done about that?
Yeah, that's again, I think oxygen was one of the most dramatic, illustrations of the insufficient infrastructure. And having been in the hospital and having survived thanks to oxygen, I'm very sensitive to it. And so, for example, in India, you could see there was even a black market on oxygen. And so that's why there's several programs now that are investing in small oxygen production, concentrating machines. It's not very expensive, Yeah. And oxygen is not only for COVID, but it can save lives of neonates, of after operations, and people with other conditions. Yeah. So it illustrates that when we deal with epidemics and prepare for the future, as Heidi said, we should not only think about a specific vaccine and an epidemic, but it's the resilience of a whole system and of society that will determine how well we're doing, plus I would say the leadership and the trust, because these two, if they're not there, then we won't. But oxygen is a really good example. So let's invest in that kind of basic infrastructure. And oxygen is would be my number one on the list, for let's say pretty simple technologies that we need to make sure that in every single community it's available.
Yes, well, actually, we had the same problem with masks and goggles in hospitals, which are pretty basic stuff. You would expect every hospital to have that.
We need to stockpile these. But oxygen is a good example of something that we need, COVID or no COVID.
Yes.
It saves lives, and we need to have it. So let's invest in it. It's very specific.
Yes. And you mentioned the quality of healthcare, but I mean your personal experience going through COVID in the UK, you realize that even in a developed country, you faced incredible difficulties, access to tests and.
Yeah, this was I got infected more than 2 years ago, at the very early days of this pandemic in March 2020, and yes, we collectively we didn't really know what to do, and the health systems in Europe were totally overwhelmed. That illustrates why it's so important to prevent cases. It's not just to have the figures down and save individual lives, but if too many people become sick and ill and at the same time and need hospitalization, that is going to cause the death of many, because the hospitals can't cope with it. Even in quite well-developed, high-developed countries, but also as a result of that, people who have cancer, who need surgery for whatever, they will not benefit from the normal medical care. So again, the impact of this epidemic goes way beyond COVID. And we see that it's been well documented that mortality from cancer in some countries has gone up as a result of COVID.
There's a question for, I guess, the two of you here from Marin Mallinson. Peter mentioned the COVID mental health impact was not well understood yet. Where would should we focus the efforts on in that regard?
Maybe I'll start. So first of all, as I mentioned, there is the direct impact. It's maybe fewer people, but when you've been in intensive care, you had to survive thanks to ventilation, you'll be isolated as a patient and all that. That plus the fact that we know today that the virus affects your brain, that we have long COVID that can affect your brain. So that's a whole new category of mental health issues, what you could call, more in the area of post-traumatic stress syndrome, but also direct impact. So that's one thing. And the family members, the household members. And then we have, the fact children who've not been able to go to school in some countries for 2 years. And countries, here, say we're in Europe, in most countries it was replaced by distant learning, and so that was more or less okay. But again, those from poorer households or in poorer countries where that did not exist, that's going to have a long-lasting impact. Maybe it's also part of mental health, but on their educational level and their opportunities in society. And then there is the rest, the anxiety and so on. But something, Heidi, you know better than I do.
Yeah, it's, as Peter said, there's the direct effects for the people affected by COVID and the neurological knock-on effects and the experience of isolation. But we're also seeing, I was just reading a report, there's been an increase in 53 million cases of depression just since the start of the pandemic. That's around the world, which is significant increase from what would be normal times, I guess. So there's this whole spectrum of things that are more actual people who had underlying mental health issues, and that they didn't get attention during COVID because of all this, demands for COVID specifically. But then there is this other area of the knock-on effects of isolation. When you were asking, when will we be out of this? Well, if we consider the indirect effects, I think it's going to be a long haul, particularly in this area of mental health. I've seen also in this age group, kind of the 18 to 28, feeling like their lives were robbed of 2 years when they would have been socializing, interacting. There have been increased suicides. It's really deep depression that you don't snap out of overnight. And you can't replace some of those years.
Domestic violence, gender-based violence, particularly against women, went up in a big way during the lockdowns and alcohol abuse and so on. So,
and we're just seeing some of the longer-term effects for children. Younger children in lockdown that, they all of a sudden something's changed and they're, at 4 years old, half of your life was in COVID. It's a hard, from a developmental perspective, we're gonna, watch this space.
We have a question for you, Peter, on from Duncan Clark on the Asian Centers for Disease Control. Is there any movement on this, or is it just a discussion? And has any country taken the leadership?
Yeah, so what I mentioned was ASEAN exists, is of course a very heterogeneous group of countries, but when it comes to viruses, they don't know any borders or respect the political systems that are very different in the region. And I know there are discussions out of ASEAN, the Secretariat, and some member states, but I don't know how far we are. But I think it's really crucial that we don't miss this opportunity, because every crisis has an opportunity and a duty to set up systems to next time that we're better prepared. So I truly hope there will be the political will, because this is a political decision, to bring it together. And I've seen what difference it can make in Africa, where for the first time, I would say, Africa stood up against this crisis, thanks also to leadership of the African Union and the fact that they had a Africa Center for Disease Control, which came out stronger out of it. But ASEAN really needs it, because the ecosystem, when you think ecologically, these are, we need to think what we call One Health. It's the health of us humans, of course, but also of all the animals, the wildlife, but also the ones that are we used to eat and all that. And that together with the ecosystem that is going to be affected by climate change, all that together goes across the borders of any member state of ASEAN. So it's really key that such a center be established as soon as possible.
I have another question for you. Actually, I have one for you coming. It's about the issue, the country of origin, or the issue of origin of COVID-19, which has become a geopolitically sensitive issue. Why would it be important to determine its origin? And even so, would this be possible given the politics and the possible scientific and technical limitations?
It's very unfortunate that what should be, let's say, a scientific question has become so politicized, and that makes it even harder to solve it. And let's also be realistic. Take SARS, that hit in 2003, China.
I was very involved in it.
Yes, exactly. And how long it took before we knew what the source was. When the virus was found in bats, you need a bit of. It's not only research, but also a bit of luck to find it. And then you can say, so what? At the moment, it's not going to make any difference in terms of what we have to do. And that's what I think matters. However, for better understanding where these epidemics, these new viruses come from, how they evolve, what the reservoir is, and so on, for that it's important to know where it came from. Not to blame one particular country or population group or even one particular set of animals. But also we know that in all these epidemics, be it HIV coming from chimpanzee, Ebola, bats, we have Lassa in Africa, we have influenza comes from poultry, from pigs, from birds, and it's all so-called zoonosis. So that's why we need to study that and work far more together also between those dealing with animal health and human health. And so finding the source is going to be important. Why? Because then we can also concentrate our surveillance for early detection of future new viruses that may be a threat to humans. So I hope that we can continue the science and the investigation there, and that it be depoliticized. At the moment, it's not very healthy, and it's actually, I think, hindering the discovery of what actually happened. And as I mentioned at the very beginning, viruses can pop up anywhere in the world. It can be in this house one day, who knows? What matters then is to act, and to act promptly. No time to lose. This is the title of my memoir, and that is to do with.
Which I encourage all of you to read. It's a fabulous book, and in fact, it even talks a little bit about me.
Yes,
I'm not very humble about it. But this is when we met, and when you appointed me as a goodwill ambassador for
UNAIDS. Yes, because of your leadership on AIDS, but also it's been published in Chinese, in Japanese, and in Korean. So in
the Chinese
this
version.
is the Chinese edition.
Fantastic. A question for you, I guess, from Elisa Kusram. Is there such a thing, or if not, should there be such a thing as mass public education regarding viruses, pandemics, and how could we collectively as people prevent or minimize their impact?
Well, I think that there is there are scientific sources on and mass access to some basic common information out there. But I think in terms of, we need to do a better job of how it's out there, how it's presented, and that it, there's so many, societies are so heterogeneous, and if we don't make that effort to not just put it in one place to make it accessible to everyone, but really take that same information, and what that campaign would look like in one setting should be different than another setting, even though the basic scientific information is the same. It's one of the big things I've heard in a lot of our research globally from people around vaccines particularly, is they feel like they're getting information pushed at them that's not relevant to their questions. So the more we can listen for what people's questions are and help facilitate getting information to them that's relevant to what they're concerned about, that's going to have more impact. Because there's so much information out there that people need help to know, to navigate it, to know what to pay attention to, what's relevant to them, because a lot of it isn't relevant to them. They don't have to be, we can't think that we're going to make all the public into, virologists or immunologists or whatever. They want to know what matters to me. And that's where we need to work harder.
That leads to an interesting question that I've been grappling with. If you were, the role of social media has completely changed the environment when it comes to rumors.
Yeah.
I mean, rumors have existed
forever,
thousands of years, actually.
Yeah.
But it was really amplified since the 2000, the turn of the... When Google, YouTube, and Facebook were created. So, because suddenly billions of people were able to talk and spread them. Now, if you were advising Facebook or one of the leading organizations, what would you tell them? When you say you cannot eradicate rumors, how do you control if you take responsibility for what is on your platform, how do you deal with that? It's a question of life and death.
Yeah, it is. And I do have regular conversations and contact with some of the companies, particularly Facebook, but also Google, YouTube, and Twitter. But I think they're faced with being told to take some basically editorial control in areas that they have no expertise in, which is why they reach out to people like me and a number of others for that. But it's a very challenging space, particularly in an epidemic when there is evolving information. So what may seem like misinformation today or a plausible thing will change. So what they've done is created this triage system where what they feel like they can legitimately delete and not betray freedom of speech are things that are overtly harmful. Drink chlorine to cure COVID. Take it off the web. Take it off. Delete it. And for these other things that are ambiguous but discouraging, the more scientifically based approaches, what they've tended to do is put, as they call them, flags to say, we recommend that this is not evidence. We recommend you going to WHO or CDC or NHS or wherever, whatever the relevant. The problem there is what we hear in our global listening with the Vaccine Confidence Project is they're sending us to places that we've been to and they don't have the answers to our questions. So I think that there's a lot more going on in trying to take it to do more than just say, oh, go to WHO, to try to direct people to alternative sources because they've been there and they want something else. So we need different alternatives. But I think that what I think we're not doing enough on is really focusing attention on the algorithms behind, because we're never going to catch up with all the bits and pieces of information, even if they had warehouses of people working full-time plus AI. You just can't. The volume of this stuff is so beyond. What we need to do is slow it down and cut it down. That's what I think. That's the only way we're going to start to get ahead of this, is to say, slow it down, and anything that's ambiguous, don't just put a flag on it. Nip it in the bud, so to speak, and then also public education in terms of think before you share, because people don't.
There's a question for you, Peter, from Valerie again. Dr. Piot, you mentioned that Japan has done better, but at a very high cost. The country has almost been shut down for 2 years. Does it mean that to fight pandemics, we face the risk of fragmentation, isolation?
Yes, when I talked about Japan, I think in the beginning, but it has also had some, death toll, but much fewer deaths than the West. And I think partly is because, of course, in Japan there is already a tradition for about 100 years since actually the Spanish flu of wearing a mask when you're have a cold or your nose ribs and so on. So that is, let's say, social etiquette that has been very precious. But it is indeed, I think, damaging now the economy. We have as a society, we need some, that's theoretically, a conversation on what is acceptable as a death toll from our disease. We accept it for influenza, for flu, because let's not forget, it's something that comes every year, and sometimes in a big way, sometimes with lesser, but every year there are thousands to sometimes hundreds of thousands of people who die from influenza, and that is fine. We accept that there are people dying from, because we have cars, in the traffic accidents. We accept that when you go skiing that you break your legs and now and then someone is paralyzed. These are theoretical concepts, but I think it's time that we put this in perspective. But the truth, on the other hand, is also, if a pandemic like COVID is out of control, that paralyzes everything. We've seen it even with Omicron, the Omicron wave, which is causing less disease, partly because we're vaccinated. We see what happens if you're not vaccinated. We see that in Hong Kong, the death toll is enormous because so many people were not vaccinated. Paradoxically, because they were not confronted with the COVID like we here in the West. But so we have to think of consider all these elements when designing a strategy. But we have to see what is acceptable. And as I said, an epidemic has to be under control because, for example, the healthcare system, healthcare workers at the forefront, they are at the highest risk of becoming infected. And if they are sick, the health system doesn't work. The police, the fire brigade, the schools, all the essential services. That's why it's so important to bring an epidemic under control. But now we have the tools to limit the damage, and then let's get on with work. But it will come back. And so we have to be prepared and have some kind of alert system. Something like, in California, one day they will have the big one. They have an earthquake. And so you have a Richter scale, and you know what's coming up, and so you can prepare. And going back to Japan, there are earthquakes all the time. I've been in quite a few, and I'm that scared. But I remember once I was drinking a kind of dry martini, and the glass went like this, and nobody cared about it. But the buildings have been earthquake-proof. I've seen that also in New Zealand, where they even modify the foundation of Parliament to make it quake-proof. So we can do things as society. Let's do it.
Yes. A question for you, Heidi. Rumors over vaccines have generated some important setbacks in Africa in terms of acceptance. Do you think it would be limited to the COVID vaccine, or should we fear further impact on key vaccines such as TB and others?
Oh, there have been, I mean, not just Africa, but have been a lot of rumors in the past about vaccines in Africa. I mean, the one I know best is because I was working on the polio eradication efforts, and we had some very serious rumors there in northern Nigeria, a boycott for 11 months because of anxieties about that were spread around the polio vaccine sterilizing people. Actually, the rumors were driven for political reasons. Nobody ever had an adverse event or a side effect, but it shut down the program for a period of time that let the virus escape. And it went, that particular strain of polio went as far as Indonesia because of the Hajj pilgrimage. And it cost the polio program $500 million to regain the progress loss, and 20 countries were reinfected. So that was just because of a rumor. And there are all kinds of studies on health-related rumors in Africa that go way back. But the one across all the different health interventions, from malaria to TB to other interventions, and vaccines seems to win the prize in terms of having had to bear the brunt of the most skepticism and rumors.
I have a follow-up question. In fact, in terms of social media, have you witnessed any particular trends in terms of age demographics? Is there a certain age group that is more receptive or engaged versus not?
To rumors, from rumors in general. I think it depends on the vaccine. I mean, if you're talking about an HPV vaccine, you know, the real anxiety is teenage girls and boys, but more with girls because the vaccine's targeting them and they have their anxieties. If it's childhood vaccines, it's the parents, often the mother. And interestingly, globally, we do see that women had more anxiety and skepticism about the COVID vaccine than men, and that's with some pretty large scale data. And with the elderly, and not just super elderly, but older groups, particularly in COVID, those were different concerns. And actually, in quote normal times, you know, adult vaccination is always lower than childhood vaccination. Some of that's because it's not part of a routine system. But there were some, Asia had, particularly with some of the older groups, concerns about the mRNA, fear of being alone and getting a side effect, a lot of, and also more steeped in traditional medicine than some of the younger.
It isn't interesting because in Europe the older age groups are the ones that are the best vaccinated,
first
like
in
nearly
line. Yes.
close to 100%.
Yeah.
Whereas, like, take Hong Kong or even
Japan,
this is the
Singapore.
elderly who are less vaccinated. It's
Yeah.
very interesting, and yet they would benefit the most.
Yes.
They're the most at risk. It's it's quite context specific.
Yeah,
it seems.
very, very context specific.
And cultural specific.
Yeah, and cultural.
Yeah, cultural. Yes.
Yeah.
We're almost running out of time, but I have one more question here, which I'll summarize. Apparently, before COVID, 90% of the French population expressed trust in science, down 70% after 2 years of COVID. What should be done looking forward to reconnect with the population, and how to speak of science in front of the public? I guess it's directed at you.
Yeah, well, interesting.
It's from Laurent Thérésien.
In France, I mean, we did the first global study, global mapping of vaccine confidence, and that's specific to vaccines, not broader science, but in 2015. And we saw actually that France was the most skeptical in the world. 41% of the population said they didn't agree with the question that vaccines are safe, or the statement, which is... But there's actually been a lot of work to rebuild confidence in France, but I think a few things went wrong. There was, it takes just one incident, like there was the interview that there was a reference to doing trials in Africa that got misinterpreted, and that created a lot of, that was outside of France. But I think that in terms of building trust in science more broadly, we need to make it more relatable. We need to make it more relevant and involve the people we're trying to communicate with in designing the communication strategies. Because, you know, a group of scientists sitting together, you know, thinking about how to communicate better without knowing who they're communicating with is not going to win this challenge.
But then on the other hand, last year when the annual trust barometer of Edelman in Europe, they gave scientists were the most trusted category of all, by far.
Yeah.
Followed business people, not so much.
Followed actually by CEOs of companies.
That's
right.
And the lowest
governments
were journalists and governments.
Politicians.
And then also scientists don't help either, because like in France we've had prominent scientists who came up for hydroxychloroquine and treatments that are really even dangerous. And so then people say who to believe. You know, so we scientists also have
some work to do.
Yes, some work to do, I think.
One more question to the two of you, in fact, and we're going to be closing very soon. Every year, donor countries invest a huge amount of money into global health organizations, such as the Global Fund, UNITAID, or Gavi. But none of these tackle the trust issue challenge that you highlighted. What would be the best operational approach to address this?
Well, I think it's absolutely an area that's underinvested in, but I'm not sure. I mean, my view is that issues around trust should be embedded in funding on whatever topic it is, if it's vaccines or, I mean, with Global Fund, it's also malaria and TB. But these programs need a budget line that's about community engagement, trust building, and actually make a concerted effort. We had the opportunity and a huge, I think, model for others when Ebola hit. The EU, the Innovative Medicines Initiative, we had a 5-year investment to the London School of Vaccine Competence Project and some partners to really focus only on trust building and community engagement around Ebola clinical trials and the rollout. That had such a tremendous value. And every delay there was with the vaccines, we were out there engaging with people, preparing them. And we got uptakes of, 95, 98%. We had in one case, there were people praying in the mosque to be selected for a trial. Who would have imagined that? But it was an investment, and I have to congratulate the EU for having recognized the importance of investment, because it does pay off. We have evidence, and we do need more funding, not in some of these organizations, but also outside.
Excellent. I'm going to use the privilege of the chairman to ask the last question, and it is about your book. It's something, I was reading it again last night. It's about You've been at the forefront of the fight against AIDS, and there was a tipping point at one point, and I remember we discussed it many times. It was the first Security Council meeting about a disease in 2000, about AIDS, and that really changed completely the game plan. And then there was a General Assembly, which interestingly was, I discovered, suggested by Ukraine.
Yes.
Of all countries, so it's quite extraordinary. Can you tell us, because this is quite extraordinary, no disease before that had been really put at that level, it really, as you said in your book, it broadened the concept of security beyond the absence of conflict. Can you tell us about this?
Yeah, I think COVID has illustrated again that this is a health problem, it's a viral infection, but you can't stop it, you can't really handle it if you only have, let's say, a medical approach. This affects society as a whole. And that leadership, whatever we think about politics, but politics is so important to, political leadership that sets up the budgets, the priorities for country. It has to be at that level. It has to involve also business, it has to involve civil society, academics, and so on. And that's what we did with AIDS, because let's not forget, AIDS cumulatively has killed about 75 million people. I mean, that's not a detail.
Terrible.
It's terrible. We tend to forget that. It's become normalized. But also, thanks to access to life-saving drugs, people don't die anymore. But that took a long time. And in order to get the stars aligned, let's put it that way, the stars being, you need technology, that's a treatment in this case, you need awareness, you need the science, you need the health system, but you need also the money, and you need the political leadership. This is where, the Security Council was important, and the General Assembly, but also the World Economic Forum. So what we did was to define AIDS not only as an infection, but as a societal issue that's affecting people, affecting economies, and even can threaten security. And I think it's one of the failures of today's leadership that COVID has not been brought to the Security Council, has not had a special session of the UN General Assembly. You can argue, okay, these are talk shops, and that's true, certainly a degree, but that's where you bring consensus, that's where you have dialogue, and for example, we succeeded in an agreement for a number of objectives that all countries committed to, something that we now have like on climate change, and again, a cynic will say countries don't, accept it or so, but it's much better than not having it. Yeah. And I think with COVID and for pandemic preparedness, we need the same. And that's why it's so important. It's on the agenda of the G20, G7, etc., African Union, European Union, but it needs to have this global type of platform where we all come together to save lives, basically.
Thank you, Peter. Saving lives. I remember when you appointed me Goodwill Ambassador, that's what you told me. I told you that I was not, the people you had were actually far more qualified than me, but you told me that communicators and journalists, when it came to AIDS, saved more lives than doctors.
Yeah.
And that's how you got me, because I was really moved. I never thought about it this way. Well, I could speak with you for hours, and I have for 20 years, but unfortunately our time is limited today, and I want to thank you on behalf of Asia Society France for, first of all, welcoming all of us to your beautiful home in Brussels, and also for your insights and for the time you've given us. And I want to take this opportunity, Peter, to thank you for accepting to become a trustee of Asia Society France. We're really delighted, and we look forward to working very closely with you and continuing our conversations. We want to thank our audience. Thank you for joining us from all around the world. And we hope that you'll be joining us for our next event, which will take place on May 10th. We will be opening our office in Paris, and we'll be gathering around an artist, Hao Shiming, whose artwork will be hung on the walls of our new place in Paris, Rue de Tilsit. So thank you all very much. Thank you, Peter. Thank you, Heidi. Thanks. And à très bientôt. Goodbye.